Hi, I'm Dr. Ravi Kiran, Manapuram, and I've founded this company called Medev Plus. It's registered as Tishyas Medical Device Development. People know it by Tishyas and Medev Plus as well. And I'm the managing director of the company as well. The company started with two other managing directors, Shweta Patnaik and Smita Patnaik, and Dr. Matthew Kurian. He's an ophthalmologist at Chaitanya Eye Hospital as well. And then we have other funding partners like PMC, Photonics Marketing Company, Mr. Atulya ji. We have VIT TBI, who gave a Bayrak seed fund. And we are also supported with BIG and Elevate from Government of Karnataka. What we do here is we are diagnosing glaucoma at a very early stage, and this diagnosis can happen anywhere at any point of time and can be done by anybody. It's a very portable device, and it can be carried in the flight as well as in the on the bike. It has been made so robust that it can be carried anywhere. It uses a very proven technology called optical coherence tomography. It is a 3D imaging technique. It passes light and gives a 3D structure of the eye, and from the 3D structure of the eye, we develop something called as a retina nerve fiber layer thickness map, and that thickness map gives the initial glaucoma causes of glaucoma. Now, since it's a 3D imaging system, it has much more potential as well. We can also look at age-related macular degeneration. We can also look at diabetic retinopathy, keratoconus, keratitis. So the entire eye diseases can be diagnosed using this technology. But currently we are focusing on glaucoma because as of now there is no tool which can identify glaucoma at a very early stage, and glaucoma being the 12% blindness causing disease that is prevalent in India. In fact, WHO and NBM from NH, all they prefer that every person who is 40 years and above needs glaucoma screening at every 6 months. So that's the requirement as of now, and that is what we have developed. We have passed our regulatory 2 days back, and we are ready for the clinical validation. We have tied up with few hospitals to get our clinical validations done. And the next step we have is to make it further small, so 6 kilograms. We have already designed, we have patented, we have one patent filed internationally and 2 more patents following up. And the entire product release is planned for this financial year, before March 31st, 2023. The funding is very important because it's a deep technology product. As of now, thanks to Indian government and thanks to Karnataka government and thanks to VIT who supported us, right now we have very low margins. We see there's quite a lot of imports in here. We are looking to raise close to 5 crore so that we can convert this product to a completely indigenous, so that we can have more margins in our product. So that's the kind of amount we are planning to raise. This particular product is equipped with so much technology. It has got an OLED inside, which was researched by multiple hospitals, and that data we have used. We have made it in such a way that one shot, it takes less than 2 minutes to get the entire scan of the eye. So it is designed in such a way that anybody, any vision technician, even a high school pass out can easily use the system. You know, Anganwadi workers can also use it, and like a set of 100 people can use it. Are trained, then this device can be taken up by the government and even internationally. It's very easy to get trained. Actually, when we heard first time about my startup TV, It was like, it was like a river flowing to the right tributary. It was like amazing. This is what something we really want, and we can go right fishing. It's for both for I think investors as well. They can find us, and we can get exposure to the right audience. There are multiple platforms, but that's the getting exposure to the right audience is very, very important. I think that's what you guys are doing.